Do you wake up 2, 3, even 4 times every night to urinate? You drag yourself to the bathroom half asleep, stumble in the dark, and by the time you get back to bed, you are wide awake. Your sleep is broken, your energy is gone, and you assume this is just part of getting older. It is not. This is Nocturia, and it is silently destroying your sleep quality, increasing your fall risk, and accelerating cognitive decline. But there is a urologist-backed method that can help you empty your bladder completely in 60 seconds before bed, dramatically reducing those nighttime trips. And I am going to show you exactly how it works. Hello, I am Dr. Elias Grant. For more than 25 years, I have worked with adults over 50, helping them solve age-related health challenges that rob them of quality of life. I have treated thousands of patients struggling with nocturia. They come to me exhausted, frustrated, and embarrassed. They avoid traveling. They stop socializing in the evening. They are afraid to sleep away from home. And the worst part? Most of them were never taught the proper techniques to fully empty their bladder or the 3 hidden triggers making their nocturia worse. Today, I am going to change that. I will show you the 3 dangerous mistakes worsening your nighttime urination and the 3 proven strategies that can cut your bathroom trips by 50% or more starting tonight. Before we go further, I need to know, how many times do you wake up at night to urinate? Once? Twice? More than 3 times? Leave your answer in the comments right now, because you are not alone, and what I am about to share could transform your nights. And if you want to sleep better, stay healthier, and protect your independence as you age, subscribe, and turn on notifications. Let me explain what is actually happening inside your body when you wake up multiple times to urinate. Nocturia is defined as waking 1 or more times during the night specifically to urinate, where sleep is interrupted by the need to void. Research shows that more than 50% of adults over 60 experience nocturia, and the percentage increases with age. By age 70, nearly 2/3 of people wake up at least twice per night. This is not just inconvenient. It is dangerous. First, let's talk about what causes nocturia. There are 3 main physiological mechanisms. Number 1, nocturnal polyuria. This means your body produces too much urine at night. Normally, your kidneys produce less urine while you sleep because of a hormone called vasopressin, also known as antidiuretic hormone. This hormone signals your kidneys to concentrate urine and retain water. But as we age, vasopressin production decreases, especially at night. Your kidneys keep producing large amounts of dilute urine even while you sleep. The result? Your bladder fills faster and you wake up more often. Number 2, reduced bladder capacity. As we age, the bladder wall can lose elasticity. Conditions like overactive bladder cause the bladder muscle to contract involuntarily, even when it is not full. For men, an enlarged prostate, known as benign prostatic hyperplasia or BPH, can block urine flow and prevent the bladder from emptying completely. For women, weakened pelvic floor muscles after childbirth or menopause can reduce bladder control. When your bladder cannot hold as much urine or cannot empty completely, you need to urinate more frequently, day and night. Number 3, fluid redistribution. During the day, especially if you sit or stand for long periods, fluid accumulates in your legs and feet due to gravity. This is called peripheral edema. When you lie down at night, that fluid shifts back into your bloodstream. Your kidneys filter it and produce urine. This is why many people with heart conditions, venous insufficiency, or diabetes experience worse nocturia. The more fluid that accumulates during the day, the more urine your kidneys produce at night. Now here is why nocturia is so dangerous. Every time you wake up, your sleep cycle is disrupted. Deep sleep and REM sleep, the most restorative stages, are cut short. Chronic sleep disruption leads to daytime fatigue, memory problems, irritability, and increased risk of depression. Studies published in the journal Sleep Medicine show that people who wake up 2 or more times per night have significantly lower cognitive function over time. But the immediate danger is even worse. Getting out of bed in the dark while half asleep dramatically increases your risk of falls. Falls are the leading cause of injury and loss of independence in older adults. One fall can fracture a hip, and recovery from hip fractures in older adults is long, painful, and often incomplete. So now let me reveal the 3 hidden mistakes that are making your nocturia worse. Mistakes that most doctors never explain. The first mistake is drinking fluids too late in the evening. This seems obvious, but most people do not realize how late is too late. Many people drink a glass of water or herbal tea right before bed, thinking it is healthy. Others take their medications with a full glass of water at 9 or 10 p.m. The problem is that your kidneys process fluids quickly. Anything you drink within 2 to 3 hours of bedtime will likely become urine while you sleep. And if you drink caffeinated beverages like coffee, tea, or soda in the late afternoon or evening, the effect is even worse. Caffeine is a diuretic, meaning it increases urine production. Alcohol is also a diuretic and suppresses vasopressin, the hormone that helps you retain water at night. I treated a patient named Richard, 64 years old. He woke up 3 to 4 times every night. When I asked him to track his fluid intake, he realized he was drinking 2 cups of coffee after dinner and a large glass of water right before bed. We shifted his fluid intake earlier in the day. He stopped drinking fluids after 6 p.m., except for small sips with medications. Within 1 week, his nighttime urination dropped from 4 times to 1. One simple change. The solution is strategic hydration. Drink most of your fluids in the morning and early afternoon. Stay well hydrated during the day so you are not thirsty at night. Stop drinking fluids at least 2 to 3 hours before bed. If you must take medications in the evening, use only a small sip of water, not a full glass. And eliminate caffeine and alcohol after 2 p.m. The second mistake is not elevating your legs during the day. If you have any degree of fluid retention in your legs and feet, that fluid will redistribute at night and turn into urine. This is one of the most overlooked causes of nocturia, especially in people with heart conditions, diabetes, or venous insufficiency. If your ankles swell during the day, or if your socks leave indentations on your skin, you have fluid retention. When you lie down at night, gravity is no longer holding that fluid in your legs. It re-enters your bloodstream, your kidneys filter it, and you wake up multiple times to urinate. The fix is afternoon leg elevation. 2 hours before bed, sit or lie down with your legs elevated above the level of your heart. Use pillows or a recliner. Stay in this position for 30 to 60 minutes. This allows the fluid to drain from your legs and re-enter circulation while you are still awake. Your kidneys will process it before you go to bed, not in the middle of the night. Clinical studies confirm that leg elevation combined with compression stockings can reduce nighttime urine volume by up to 30%. Compression stockings work by applying gentle pressure to your legs throughout the day, preventing fluid from accumulating in the first place. If you have significant swelling, talk to your doctor about medical-grade compression stockings. The third mistake, and this is the most important, is not emptying your bladder completely before bed. Most people urinate once before bed and think they are done. But if you have reduced bladder tone, an enlarged prostate, or weakened pelvic muscles, your bladder may not empty fully. You might leave 50, 100, even 150 milliliters of urine behind. That residual urine stays in your bladder, and within 1 or 2 hours, your kidneys produce more urine, your bladder reaches capacity again, and you wake up. You are trapped in a cycle of incomplete emptying. This is where the 60-second double voiding technique comes in, and it is a game changer. Double voiding is a method used by urologists to help patients with incomplete bladder emptying. Here's how it works. Step 1. Urinate normally before bed. Do not rush. Relax and let your bladder empty as much as possible. Step 2. Stand up or shift your position. Men, if you were sitting, stand. Women, stand up and sit back down. This position change can shift any remaining urine toward the bladder outlet. Step 3. Wait 30 to 60 seconds. During this time, gently lean forward or rock side to side. This creates slight pressure on the bladder. Step 4. Try to urinate again. Even if you do not feel the urge, try. You will often find that more urine comes out, sometimes a surprising amount. This technique takes less than 60 seconds, and it can reduce nighttime urination significantly. I have had patients tell me they went from waking up 3 times a night to waking up once, or not at all, just by mastering this method. Now let me show you the 3 proven strategies that can cut your nighttime bathroom trips in half and help you sleep through the night. Strategy number 1, the timed voiding schedule. Most people urinate only when they feel the urge. But if you have nocturia, this reactive approach does not work. Instead, you need a proactive schedule. The goal is to train your bladder to empty on a predictable timetable during the day so that nighttime production is minimized and your bladder is fully empty before bed. Here's the protocol. During the day, urinate every 2 to 3 hours, whether you feel the urge or not. Set reminders on your phone if necessary. Do not wait until your bladder is uncomfortably full. This prevents your bladder from becoming overdistended, which weakens the bladder muscle over time. At night, establish a pre-bed voiding routine. 1 hour before bed, urinate. Then, right before you get into bed, use the double voiding technique I just taught you. This ensures your bladder is as empty as possible before sleep. Additionally, practice pelvic floor exercises during the day, also known as Kegel exercises. These exercises strengthen the muscles that support your bladder and improve bladder control. For men and women, the technique is the same. Tighten the muscles you would use to stop urinating midstream. Hold for 5 seconds, then relax for 5 seconds. Repeat 10 times, 3 times a day. Do not hold your breath. Over weeks and months, stronger pelvic muscles improve bladder capacity and reduce urgency. Strategy number 2. Optimize your medications and timing. Many common medications worsen nocturia, and most people do not realize it. Diuretics, commonly called water pills, are prescribed for high blood pressure, heart failure, and fluid retention. They work by increasing urine production. If you take a diuretic in the late afternoon or evening, you will urinate more at night. The solution is to take diuretics in the morning, ideally no later than 2 p.m. This allows your body to process the extra urine during the day, not while you sleep. Other medications that can contribute to nocturia include certain blood pressure medications, antidepressants, and sedatives. Some medications cause dry mouth, leading people to drink more fluids at night. Others interfere with vasopressin, the hormone that concentrates urine. If you are taking multiple medications and experiencing nocturia, schedule a medication review with your doctor. Ask specifically, could any of these medications be contributing to my nighttime urination? Can we adjust the dose or timing? I treated a woman named Linda, 67 years old. She was waking up 4 times a night. She was taking a diuretic for blood pressure at 6 p.m. I worked with her cardiologist to move the medication to 8 a.m. Within 3 days, her nighttime urination dropped to once per night. Such a simple change, such a dramatic result. Strategy number 3. Create the ideal sleep and bladder environment. Your bedroom setup and bedtime routine directly impact nocturia. First, keep your bedroom cool. A room that is too warm increases sweating and fluid loss, which can trigger thirst and nighttime drinking. Aim for a temperature between 60 and 67 degrees Fahrenheit. Second, use a nightlight and clear a path to the bathroom. If you do need to get up, you should be able to do so safely without turning on bright lights, which disrupt your circadian rhythm and make it harder to fall back asleep. Third, avoid large meals within 3 hours of bedtime. When you eat a big meal, especially one high in salt or sugar, your body retains more water and produces more urine. Additionally, salty foods increase thirst, leading to more fluid intake at night. Eat your largest meal at lunch and keep dinner light and early. Fourth, manage underlying health conditions. Diabetes is a major cause of nocturia because high blood sugar causes your kidneys to produce more urine. If you have diabetes, work with your doctor to optimize blood sugar control. People with well-controlled diabetes experience significantly less nocturia. Sleep apnea is another hidden trigger. When you stop breathing repeatedly during the night, your body releases hormones that increase urine production. If you snore loudly, wake up gasping, or feel exhausted despite sleeping, get evaluated for sleep apnea. Treating sleep apnea with a CPAP machine can reduce nocturia dramatically. Heart failure also causes nocturia because fluid accumulates in your body during the day and is processed at night. If you have swelling in your legs, shortness of breath, or fatigue, talk to your doctor about your heart health. Proper management of heart failure with medications and lifestyle changes can reduce nighttime urination. Now, let me teach you the advanced double voiding technique in detail, because mastering this can be the single most effective thing you do. When you urinate before bed, sit or stand in a relaxed position. Do not strain. Let gravity and your bladder muscle do the work. Urinate until the stream stops naturally. Then, instead of immediately leaving the bathroom, stay there. Take a deep breath. Lean forward slightly if sitting, or shift your weight if standing. Men, try gently pressing on your lower abdomen, just above the pubic bone. Women, try rocking your pelvis forward and back. Wait 30 to 60 seconds. Then try to urinate again. You may be surprised to find another 50 to 100 milliliters of urine. This residual urine is what would have woken you up 1 to 2 hours later. Some patients also benefit from timed bathroom trips during the night. If you consistently wake up at the same time, say 3 a.m., set an alarm for 2:30 a.m. Get up, urinate, and go back to sleep. This proactive approach empties your bladder before it reaches the critical volume that wakes you. Over time, you can gradually push the alarm later, retraining your bladder to hold more urine overnight. Now let me give you additional strategies that address less obvious causes of nocturia and help you maximize results. One often overlooked factor is magnesium deficiency. Magnesium plays a role in muscle relaxation, including the bladder muscle. Low magnesium levels can contribute to bladder irritability and frequent urination. Foods rich in magnesium include leafy greens, nuts, seeds, and whole grains. Some people benefit from a magnesium supplement taken in the evening, but consult your doctor first, especially if you have kidney disease. Another factor is vitamin D deficiency. Research shows a link between low vitamin D levels and overactive bladder symptoms. Vitamin D supports muscle function and immune health. Ask your doctor to check your vitamin D level and supplement if necessary. Bladder irritants are another hidden trigger. Certain foods and beverages irritate the bladder lining and increase urgency and frequency. Common irritants include caffeine, alcohol, artificial sweeteners, spicy foods, citrus fruits, and carbonated drinks. Try eliminating these one at a time for a week to see if your symptoms improve. Many people find that cutting out caffeine alone reduces nighttime urination significantly. Stress and anxiety also play a role. When you are anxious, your nervous system is overactive, which can trigger more frequent urination. Practice relaxation techniques before bed, such as deep breathing, progressive muscle relaxation, or meditation. Create a calming bedtime routine. Read, listen to soft music, or take a warm bath. Avoid screens for at least 1 hour before bed, as blue light disrupts melatonin production and sleep quality. Weight management is another critical factor. Excess body weight puts pressure on the bladder and pelvic floor muscles, reducing bladder capacity and control. Losing even 5 to 10% of your body weight can improve nocturia symptoms significantly. Focus on whole foods, regular physical activity, and portion control. Let me also address a concern many people have. Is it dangerous to hold your urine and not get up at night? The answer depends on the situation. If you feel a strong, painful urge, you should get up and urinate. Ignoring a full bladder can lead to urinary retention, bladder infections, or bladder damage. However, if you wake up with only a mild urge, you can try relaxation techniques and attempt to fall back asleep. Over time, this can retrain your bladder to hold more urine. But never force yourself to hold urine to the point of pain or extreme discomfort. Now, when should you see a doctor? If you are waking up 3 or more times per night despite trying these strategies, you need a medical evaluation. If you experience pain, burning, blood in your urine, or difficulty starting urination, see a doctor immediately. These could be signs of a urinary tract infection, kidney stones, prostate problems, or bladder cancer. If you have sudden onset of severe nocturia, especially with swelling, shortness of breath, or chest pain, seek emergency care, as this could indicate heart failure or kidney disease. Your doctor may perform tests including a urinalysis to check for infection or diabetes, a bladder scan to measure residual urine after voiding, blood tests to check kidney function and electrolytes, and avoiding diary where you record fluid intake, urine output, and timing for several days. Based on the results, your doctor may recommend medications such as anticholinergics for overactive bladder, alpha blockers for prostate enlargement in men, or desmopressin to reduce nighttime urine production. Let me share one more success story. I treated a man named James, 71 years old. He was waking up 5 times every night. He was exhausted, depressed, and his wife was concerned. We implemented the full protocol. He stopped drinking fluids after 6 p.m. He elevated his legs every evening for 45 minutes. He started using compression stockings during the day. He moved his diuretic to the morning. and he mastered the double voiding technique before bed. Within 3 weeks, he was down to 1 nighttime trip. Within 2 months, he was sleeping through the night 3 or 4 times per week. His energy returned. His mood improved. His relationship with his wife improved. He told me it changed his life. So let me bring this all together. Waking up multiple times at night to urinate is not normal aging. It is nocturia, and it has specific causes and proven solutions. The 3 mistakes making it worse are drinking fluids too late, not elevating your legs to reduce fluid retention, and not emptying your bladder completely before bed. The 3 strategies that work are timed voiding with pelvic floor exercises, optimizing medication timing, and creating the ideal sleep and bladder environment. Add to that the 60-second double voiding technique, and you have a comprehensive system that can reduce nighttime bathroom trips by 50% or more. Start tonight. Stop drinking fluids 3 hours before bed. Elevate your legs for 45 minutes this evening. Before bed, use the double voiding technique. Urinate. Wait 60 seconds, shift position, and try again. Do this consistently for 1 week and track your results. Now, tell me in the comments, how many times are you waking up at night? Have you tried any of these techniques before? Starting tonight, will you commit to the double voiding method? Your feedback helps other people realize they are not alone and encourages them to take action. If this video helped you, press like so more people can discover this information and finally sleep through the night. Share it with someone you know who is struggling with nocturia. Subscribe and turn on notifications, because every week I share proven strategies to improve your health, energy, and quality of life as you age. I am Dr. Elias Grant. Better sleep is possible. Better health is possible. You just need the right information and the commitment to apply it. Take care of yourself. You deserve restful nights and energized days.